The pain I'm about to describe has made retired police officers cry, sent former athletes to the floor, and left people whispering, something is ripping me apart from the inside. If you've never had a kidney stone, you may think this is just another health scare video. It isn't. And if you have had one, you already know I'm not exaggerating. I'm Dr. Michael Joel, and in the next few minutes, you're going to understand why a stone smaller than a pea can feel bigger than your entire body, why the pain seems to move like a living thing, and why one symptom in particular means you should stop waiting and get help immediately. Please subscribe today for clear, life-saving health guidance that protects your future, supports your family, and helps you age stronger. Because what we're talking about today is not just pain. It's a medical emergency that people often misunderstand. Somewhere in America tonight, someone in Phoenix, Tampa, or Columbus is pacing a bedroom, clutching their side, unable to sit, unable to lie down, unable to think clearly enough to decide whether this is something they can ride out or something that could cost them a kidney. And that uncertainty, that terrible gap between pain and understanding, is exactly what makes kidney stones so frightening. Now, let me say something carefully, because words matter. Are kidney stones the single most painful thing a human can experience? Medicine can't measure suffering like a stopwatch, but I can tell you this. Over and over, people describe kidney stone pain as one of the worst pains of their lives. Worse than surgery recovery, worse than a broken bone, worse than gallbladder attacks, worse, some say, than childbirth. And what makes that statement so unsettling is not the size of the stone. It's the violence of the process. A tiny piece of hardened crystal can turn an ordinary Tuesday morning in suburban America into a full-blown medical crisis before breakfast. Let me tell you about Robert, 72 years old, a retired mail carrier from Mesa, Arizona. Robert was loading bottled water into the trunk of his car outside a grocery store when he felt what he thought was a pulled muscle in his right lower back. He paused, stretched, took a breath, and kept going. 10 minutes later, he was bent over the shopping cart, sweating through his shirt, unable to stand up straight. By the time his daughter reached him, the pain had wrapped from his side toward his lower belly, and Robert kept saying the same thing over and over. I can't get comfortable. I can't get comfortable. That sentence matters more than people realize. Because kidney stone pain, unlike a sore muscle or stiff joint, usually does not improve when you change position. You don't lean one way and feel better. You don't stretch and find relief. You don't lie down and settle it. In fact, many people become restless, almost frantic. They pace, they bend, they stand, they sit, then they stand again. And the reason is brutally simple. When a stone drops from the kidney into the ureter, the narrow tube carrying urine down to the bladder, it can partially or completely block the flow. Urine backs up, pressure rises, the kidney swells, the ureter spasms, nerves fire, and your body reacts like it has been blindsided. That is the first thing most people get wrong. They think the pain comes from the stone being sharp and scraping like broken glass. That can happen to some degree, yes, and it can cause blood in the urine. But the real agony often comes from pressure and spasm. Imagine trying to force fluid through a straw that suddenly has a pebble jammed inside it. The system behind that blockage keeps pushing. The tube contracts in waves trying to move the obstruction. Pressure builds upstream. That's why the pain comes in surges. 1 minute you're gasping. The next minute it eases just enough to make you think maybe it's over. Then the next wave hits and it's back. And this is where kidney stones become such excellent liars, because the pain doesn't always stay where it started. People think, if it's my kidney, the pain should stay in my kidney area. No. As the stone moves, the pain can travel. It may begin in the side or back, just below the ribs. Then it can creep forward into the lower abdomen. Then it can drop into the groin. Men may feel it in the testicle. Women may feel it deep in the pelvis and think something gynecologic is happening. The stone moves, the ureter reacts, and the map of pain keeps changing. That shifting path is one of the classic signs that separates kidney stones from many everyday aches. Let me tell you about Linda, 69 years old, from Sarasota, Florida. Linda woke up at 3:20 in the morning with pain low on the left side and thought it was her hip. By 4 a.m., she thought it might be diverticulitis. By 4:30, the pain had dropped toward her groin and she was certain something terrible had ruptured. Her husband said the most alarming part wasn't just the pain, it was the speed. An hour earlier, she had been asleep. Now she was pale, nauseated, and gripping the bathroom counter so hard her knuckles were white. That speed, that sudden transformation from normal to overwhelmed is something kidney stones do with almost theatrical cruelty. And if you've never seen it, it's hard to understand just how physical the suffering becomes. People don't just say it hurts, they sweat. they vomit, they shake, they become short-tempered or panicked because the nervous system is getting hit from several directions at once. Pain itself can trigger nausea. The pressure in the urinary tract can be intense. The body's stress response kicks in. Adrenaline rises, breathing changes, muscles tense. Suddenly, a person who usually handles discomfort quietly is moaning, pacing the hallway, and begging for it to stop. This is not weakness. This is not overreaction. This is what severe renal colic can do to a very strong human being. I once had a patient from Dallas, a 74-year-old retired firefighter named Tom, who told me, "Doc, I've had burns, broken ribs, and shoulder surgery. None of them made me feel this helpless." That word helpless stayed with me because kidney stone pain is not only severe, it feels unpredictable. With a bad knee, you know not to climb stairs. With back pain, you know twisting may worsen it. With a stone, the body turns against you and pulses. The pain may ease just long enough for hope to come back, then surge so hard that hope disappears again. That unpredictability is exhausting. It drains not just your body, but your ability to think clearly and make good decisions. Now, let me explain why those waves happen. Because once you understand this, the whole experience makes more sense. The ureter is not a passive pipe. It's muscular. It contracts rhythmically to push urine downward. When a stone gets stuck, that muscular tube keeps trying to do its job. It squeezes against the obstruction. That creates the classic waxing and waning pattern people describe. The pain builds, peaks, then eases. Builds, peaks, then eases. But do not let those quiet moments fool you. The problem may still be there. A temporary lull does not always mean the stone has passed. It may simply mean the pressure shifted or urine found a tiny path around the stone for a little while. And then there's the nausea, which surprises many people. They expect pain. They don't expect their stomach to revolt. But the kidneys, ureters, and digestive system share nerve pathways and reflexes that can make the entire body feel under attack. That's why someone with a kidney stone may lean over a sink vomiting even though the original problem is in the urinary tract. That's why they may lose their appetite completely. That's why a person can look ghostly pale and clammy. When severe pain, pressure, and autonomic nerve responses pile on top of each other, your body stops acting like it's dealing with a simple stone and starts acting like it's in emergency mode. Now, here is where I need you to pay very close attention because this next part can save a life. Kidney stone pain by itself is miserable. Kidney stone pain with fever or chills is different. That combination can mean the stone is blocking urine and infection is trapped behind it. And when infected urine cannot drain, bacteria can spread fast, very fast. In older adults especially, this can tip from "I'll wait until morning" into sepsis territory before a family member fully understands what's happening. So if there is shaking chills, fever, confusion, or a generally toxic, terribly sick feeling on top of stone-like pain, that is not a wait-and-see situation. That is urgent. Let me tell you about Betty, 76, from Knoxville, Tennessee. Betty had flank pain all afternoon and assumed it was a stone because she'd had 1 year earlier. She took a hot shower, tried to rest, and planned to call her doctor in the morning. But as evening came, she started shivering under a blanket, even though the house wasn't cold. Her daughter noticed Betty looked flushed, weak, and strangely slow to answer questions. By the time they got to the emergency room, Betty had both an obstructing stone and an infection. She needed rapid treatment, IV antibiotics, and a procedure to relieve the blockage. If they had waited overnight, the story could have ended very differently. That's why the most dangerous symptom is not always the pain itself. It's the pain plus the wrong companion symptom. Fever, chills, trouble passing urine, severe vomiting that keeps you from holding fluids down, worsening weakness. These are the signs that transform kidney stones from a brutal pain problem into a real medical danger. And unfortunately, people over 60 often dismiss these signs because they don't want to make a fuss, or they worry about spending hours in the hospital, or they assume they're overreacting. But the body does not reward politeness when a kidney is obstructed and infected. The body rewards speed. Sometimes fast action is the difference between a miserable night and a catastrophe. There's another warning sign I need you to remember, and it's one people underestimate. Inability to urinate or only passing tiny amounts while feeling pressure and urgency can be serious. Now, not every kidney stone causes complete blockage. Many do not. But if you feel like you have to go constantly and almost nothing comes out, or you stop urinating normally while the pain escalates, something may be obstructing the system in a significant way. The urinary tract is supposed to flow. When flow stops, pressure changes. And prolonged obstruction is not just painful, it can injure the kidney. That's why we don't judge kidney stones only by how much they hurt. We judge them by what they're doing. And yes, blood in the urine can happen too. Sometimes it's obvious, pink, red, even brownish. Sometimes it's invisible to the eye and only shows up on testing. People see blood and panic, which is understandable. But blood alone doesn't tell you how large the stone is. It tells you the urinary tract has been irritated. The same goes for burning with urination, foul-smelling urine, or sudden urgency when the stone gets close to the bladder. Those symptoms can make people think, oh, this is just a urinary tract infection. Sometimes it is not. Sometimes it's a stone irritating the lower urinary tract. And sometimes, unfortunately, it can be both at once, which is why evaluation matters. Now, here's a trap that fools people all across America, and it fools smart people too. The pain stops, so they assume the danger is past. Sometimes that's true. Sometimes the stone slips into the bladder and the severe ureter pain finally lets go. But not always. A pain-free period can mean the stone shifted position without fully resolving the obstruction. It can mean the ureter stopped spasming as hard for a while. It can even mean the kidney is under pressure, but the dramatic wave pain has temporarily quieted. So if you had classic stone pain, and then the pain vanishes without seeing the stone pass, without improvement in urination, or while other symptoms continue, do not automatically celebrate. Let's clear up another myth, because this one causes endless confusion. Bigger stone does not always mean bigger pain. A tiny stone in the wrong place can produce extraordinary agony if it wedges into a narrow part of the ureter and blocks flow. Meanwhile, a larger stone sitting quietly inside part of the kidney may cause little or no pain at all for a long time. That's why someone can pass a tiny stone and swear it was the worst pain of their life, while another person discovers a surprisingly large stone on imaging after vague discomfort or even by accident. Pain tells you how the stone is behaving, not simply how large it is. That distinction matters tremendously. In fact, some stones are silent for months or years. They sit there while minerals continue to build. No alarm, no warning. Then one day they shift. That's when the nightmare begins. A person who felt perfectly fine at dinner can be in the emergency department before midnight. And because the timing is so abrupt, many people assume the stone must have formed that day. Usually it didn't. The crystal had likely been growing quietly in concentrated urine over time. Then motion, gravity, anatomy, bad luck, whatever you want to call it, set it free. The moment it moved into the ureter, the body stopped being quiet and started screaming. That's the moment most people remember forever. So what happens when you go to the emergency room or see a doctor for suspected kidney stones? First, we listen to the story very carefully because the pattern matters. Side pain radiating downward, waves of pain, nausea, restlessness, blood in the urine, trouble urinating, fever. Then we look for signs of something more dangerous because not every bad pain in the side is a stone. Sometimes it's appendicitis. Sometimes it's gallbladder disease. Sometimes it's an aneurysm, infection, bowel trouble, or another urgent condition. That is why self-diagnosis has limits. The body reuses pain pathways. Your job is to notice warning signs. Our job is to separate the likely from the lethal. Testing often includes a urine sample, sometimes blood work, and in many cases imaging to see whether a stone is present, where it is, and whether it's causing blockage. Patients are often shocked by how fast the medical conversation shifts from pain control to drainage or procedure if infection is involved. And that's because the treatment plan changes completely when there is a blocked infected system. In a simple stone, we may focus on helping it pass and managing symptoms. In a dangerous stone, our priority becomes protecting the kidney and preventing bacteria from getting the upper hand. Kidney stones may begin as a stone problem, but they become a systems problem very quickly when urine cannot move. Pain control matters too, and I want to say this because older adults often try to be heroes. There is no prize for suffering through untreated renal colic. The pain can be so intense that it raises blood pressure, dehydrates you through vomiting, disrupts sleep, and leaves you unable to function safely. Proper treatment may include anti-inflammatory medication, nausea medication, IV fluids when needed, and sometimes medicines that help relax the ureter so a smaller stone has a better chance of passing. That is not taking the easy way out. That is appropriate medical care. Pain this severe is not just uncomfortable. It interferes with the body's ability to keep itself steady and with your ability to know when danger is escalating. Now let's talk about what determines whether a stone may pass on its own. Because this is where people start making decisions based on internet myths and neighbor stories. Size matters, yes. Location matters too. A smaller stone lower in the ureter may pass more easily than a slightly larger stone higher up. But there is no magic guarantee. One person passes a stone and says, "Drink water and walk it off." Another ends up needing a procedure for something not much bigger. So please hear me clearly. Passing a stone is not a character test. It is anatomy, physics, inflammation, and chance. If symptoms are severe or complications show up, the correct plan may be intervention, not endurance. Let me tell you about James, 67, a retired accountant from Akron, Ohio. James had a stone that looked on paper like it might pass. He was sent home with medication, instructions to hydrate, and a strainer to catch the stone if it came out. For 2 days he managed. On the third day, the pain escalated. He could not keep fluids down, and he told his wife the pain felt lower, but more relentless. Imaging showed the stone was still there, lodged stubbornly where the ureter narrows near the bladder. James eventually needed a ureteroscopy, where a small scope is passed through the urinary tract so the doctor can reach the stone, break it up, and remove fragments if needed. And yes, sometimes that means a stent afterward, which sounds alarming until you understand the purpose. The stent is not punishment. It is a temporary little tube designed to help urine drain and let the ureter recover after irritation, swelling, or stone removal. Patients don't always love the feeling of a stent, and I won't pretend they do, but many are deeply relieved once the obstructing stone is gone and the savage pressure pain is no longer dictating every second of the day. This is another point people miss. The goal is not merely to eliminate the stone. The goal is to restore flow, protect the kidney, reduce infection risk, and stop the body from living in that relentless emergency signal. Now, you may be wondering how these stones form in the first place. The answer is not mysterious, but it is sneaky. Your urine contains dissolved minerals and other substances all the time. Usually they stay dissolved and leave the body without drama. But when the urine becomes too concentrated, or the chemistry shifts in the wrong direction, crystals can start sticking together. Over time, those crystals can grow into a stone. The most common stones in America contain calcium, often calcium oxalate. Others involve uric acid, infection-related material, or rarer inherited conditions. But the larger principle is simple. A stone is what happens when the balance inside the urinary system stops favoring flow and starts favoring crystallization. And this is why dehydration is such a big deal, especially for older adults. As we get older, many people drink less than they should. Some do it because thirst signals are weaker. Some do it because they don't want to get up at night to urinate. Some do it because they're busy or because their medication schedules, mobility issues, or bladder concerns make drinking feel inconvenient. But concentrated urine is the perfect environment for crystals to meet, cling, and grow. In hot states like Arizona, Texas, or Florida, the risk becomes even easier to understand. More sweating, more fluid loss, less water in the urine, more opportunity for mineral trouble. Stones love a dehydrated system. Now let's talk about sodium, because people obsess over sugar and forget about salt. A high sodium diet does more than raise blood pressure. In people prone to certain stones, too much sodium can increase calcium in the urine, which can increase stone risk. And if you look at the standard American diet, sodium is everywhere. Canned soup, deli meat, frozen dinners, fast food, restaurant meals, snack foods. The little invisible extras add up fast. A senior in St. Louis may feel like they hardly use the salt shaker, yet still eat thousands of milligrams a day without realizing it. That hidden sodium burden is one of the quiet reasons some people keep forming stones even when they think they're eating pretty well. Here's another prevention mistake that almost nobody explains clearly, and it surprises people every time. They hear the words calcium stone and conclude, then I should avoid calcium. Not necessarily. In fact, getting calcium from food in proper amounts can actually help in some situations because calcium in the digestive tract can bind certain compounds before they reach the urine in troublemaking amounts. The goal is not random restriction. The goal is the right balance. This is especially important for older Americans because seniors also need to protect bone health. So please do not slash calcium indiscriminately, especially supplements or diet choices, without having that conversation with your own clinician. Kidney stone prevention should not come at the cost of your skeleton. Then there's oxalate, a word most people never hear until after their first stone. Certain foods can be high in oxalate, and for people who form calcium oxalate stones, that can matter. Spinach, nuts, rhubarb, wheat bran, some other foods too. But this is where people become overly simplistic. They go online, find a list, and decide half the produce section is forbidden forever. That is rarely the smartest long-term approach. Stone prevention should be personalized to the type of stone you form and your overall health needs. The point is not to fear food. The point is to stop feeding the chemistry that keeps creating stones. And that takes a plan, not panic. Animal protein can play a role too, especially in some stone types. Heavy intake can shift urine chemistry in ways that make stones more likely for certain people. So can obesity, diabetes, digestive diseases, repeated infections, and some medications or supplements. This is why I get frustrated when people treat kidney stones like bad luck and nothing more. Luck matters, genetics matter, but lifestyle and metabolism matter too. The person who says, I just have bad kidneys, may actually have a pattern that can be improved. Lower sodium, better hydration, smarter protein balance, addressing diabetes, reviewing supplements. These changes are not glamorous, but they are often the difference between one stone and a repeat performance that ambushes you again. If you've ever had a stone, one of the most important things you can do after the crisis is not just move on, learn from it. If you pass the stone, try to save it if your doctor asks you to. Why? Because the stone's composition can guide prevention. A uric acid stone is not the same story as a calcium oxalate stone. An infection stone is not the same story as a cysteine stone. When patients skip that step, they stay trapped in guesswork. And guesswork is how people end up drinking gallons of lemon water, avoiding every dairy product in sight, and still landing back in the emergency room 6 months later with the exact same problem they never truly understood. Now, let me give you a simple prevention image to hold on to, because it helps people remember. Your urine should not look like apple juice all day. For most people, pale yellow is a better target than dark, concentrated urine. That does not mean chugging absurd amounts at once. It means consistent hydration across the day, unless your own doctor has given you fluid restrictions for another condition. A lot of seniors tell me, Doc, I drink when I'm thirsty. The problem is that thirst is often a lagging signal. By the time you feel very thirsty, you may already be behind. The kidneys are chemistry laboratories. They do better when the raw material, water, arrives steadily instead of after long dry stretches. But there's a darker lesson here, and it's one I really want you to hear. Sometimes the greatest danger with kidney stones is not the stone. It's the waiting. The deciding to tough it out because the hospital is inconvenient. The deciding to wait until morning because you don't want to bother your daughter. The deciding that vomiting, shaking, and severe pain are simply part of the process. That mindset is how people miss the moment when a miserable but manageable problem becomes a kidney-threatening or infection-driven emergency. I am not telling you to run to the ER for every twinge in your back. I am telling you not to let pride, inconvenience, or uncertainty overrule obvious red flags when they appear. Harold, 71 from Boise, Idaho, made that mistake. He had classic stone pain on a Saturday evening and had every intention of getting checked if it wasn't better by Monday. By midnight, the pain was less severe, so he assumed the worst was over. What he didn't realize was that his urine output had dropped and he was starting to feel chilled. His son found him the next morning exhausted, dehydrated, and far sicker than Harold wanted to admit. He needed urgent treatment for an obstructing stone and infection. The part that stayed with the family was not that Harold ignored severe pain. It was that he ignored the change in the pattern. And with stones, pattern changes can mean everything. So how do you tell possible stone pain from something like a pulled muscle, especially if you're watching this after a long day of gardening or lifting boxes? A muscle strain often worsens with movement, twisting, or direct use of that area. It may feel sore or tight. Kidney stone pain is more likely to feel deep, internal, wave-like, and oddly untouchable. You can't press on one spot and reproduce it neatly. It often comes with nausea, urinary symptoms, blood in the urine, or that restless need to move because nothing relieves it. Again, not every side pain is a stone. But when the pain is severe, moving downward, and paired with urinary or stomach symptoms, the suspicion should rise quickly. And if you're a caregiver, this matters even more. Seniors do not always describe symptoms in textbook language. They may say, I just don't feel right. They may mention back pain when the true pain is in the flank. They may focus on nausea and barely mention the urinary urgency. They may understate a fever or forget to say they have barely urinated. So if your spouse, parent, brother, or neighbor is suddenly pale, pacing, clutching one side, vomiting, or having trouble passing urine, listen to the pattern, not just the exact vocabulary. Sometimes the difference between a good outcome and a frightening one is one family member who recognized that this was not ordinary discomfort and acted before dawn. Let me bring this all together because I want you to leave this video with something useful, not just fear. Kidney stones become so painful because they obstruct a narrow muscular tube, raise pressure behind the blockage, trigger spasms, and send pain signals that can radiate from the side to the groin in relentless waves. The pain may be among the worst a person ever experiences, not because the stone is enormous, but because the anatomy is unforgiving. The danger rises sharply when the stone is paired with fever, chills, inability to urinate, severe vomiting, weakness, or signs that the body is becoming overwhelmed. And prevention begins long before the pain with hydration, diet, and understanding your specific stone type. So here's the checklist I want burned into your memory. Severe side or back pain that comes in waves and moves downward. Think kidney stone. Can't get comfortable no matter how you sit or stand. That fits too. Nausea, vomiting, blood in the urine, urgency, or burning. The suspicion rises. Fever or chills with stone pain. Stop waiting. Trouble urinating or only passing tiny amounts while the pain escalates. Get evaluated. Pain disappearing without clear resolution. Don't assume the story is over. And if you've had one stone before, take prevention seriously because your body has already shown you it knows how to make them. The first stone is a warning. The second one is often the price of ignoring it. I wish I could tell you there's a secret trick, one magical food or one miracle drink that guarantees you'll never face this again. But the truth is both simpler and harder. Prevention is usually a collection of ordinary decisions made consistently. Enough water, less sodium, smarter protein choices when needed. Not overcorrecting calcium without guidance. Following up after a stone, learning what type you formed, respecting symptoms early. These are not dramatic changes, but they are powerful ones. Your kidneys work quietly for you every day of your life. They deserve a system that lets them keep flowing, filtering, and protecting you instead of turning your urine into a crystal factory you discover only when agony arrives. And I want to end with this because it matters. If you are watching this after having survived a kidney stone, you are not dramatic, weak, or bad with pain. What you felt was real. If you are watching this because someone you love is prone to stones, your attention may one day help you spot the warning sign that gets them care in time. And if you are watching this simply to understand whether kidney stones really can be that painful, the answer is yes. Absolutely yes. Not for everyone, not every time, but often enough that no one should dismiss them. Share this video with someone who needs it, take your hydration seriously, and I'll see you in the next video.